Their smiles, their laughter, and even their cries are music to our ears. Babies, these little miracles of life have a special place in the hearts of young and old alike. Holding them in our arms and realizing we are the only source of care and protection for their vulnerability sparks an indescribably warm feeling in our hearts. No matter what culture or ethnicity they are from, infants have always been the center of attention and continue to draw us close to themselves with the magic of their being. These precious souls are the hidden jewels of our lives that touch our very core. Sadly, there is an epidemic striking these defenseless beings within our society. An unrevealed truth that is haunting these precious miracles in today's Jewish community. With an increase in the number of abortions, the facts speak for themselves as this procedure is slowly becoming a trend. This is Miracles Interrupted.
I'm a reproductive endocrinology infertility specialist practicing in Encino, California. I was formally trained as an obstetrician gynecologist after I completed a 4-year residency. I'm in the business of helping couples conceive and make babies. The correlation between infertility and abortion does exist, particularly when one is discussing surgical terminations of pregnancy. The link tends to be with respect to damage to the uterus that can occur after a surgical termination of pregnancy. Surgical termination of pregnancy means that the pregnancy is oftentimes removed via a suction curettage procedure. Suction curettage procedure means that an instrument is inserted into through the cervix and into the uterine cavity, and the contents of the pregnancy are recovered by a gentle suction. Oftentimes, with that procedure, a surgical curettage procedure is performed where a surgical instrument called a curette is inserted through the cervix into the uterus, and the lining of the uterus is scraped, if you will, to recover or remove any residual products of conception. That curetting procedure can sometimes lead to damage to the inside lining of the uterus in the form of scar tissue formation. And scar tissue formation, depending of course on the severity, can lead to infertility, can lead to pregnancy loss, can lead to obstetrical complications, and so on. The uterus of a woman after an abortion is a healing process because the abortion process, most of the time, particularly if it's done through a sharp curettage procedure with a sharp instrument that scrapes the inside of the uterus, damages the inside lining of the uterus inevitably. I'd like to summarize the potential risks of surgical termination or an elective termination of pregnancy. It's important that patients understand how the procedure exactly is done and what exactly the potential risks are. One of the risks is that one has to dilate the cervix, one has to open up the cervix in order to gain access to the uterine cavity. That's done with sharp surgical instruments, which can on occasion damage the cervix. Permanent damage is possible. There have been some studies to suggest that the cervix loses some of its integrity, if you will, after you dilate it multiple times. So in women that have had multiple terminations, and each time the cervix had to be dilated, there may be a small association between that and what's called cervical incompetence. So the long-term consequences could be that the cervix during a wanted pregnancy can open up prematurely in the late first trimester or even second trimester, which could lead to an early birth. But that's less of an issue. The damage at the time of termination, using surgical instruments to dilate the cervix, can lead to damage, including scarring, including bleeding of when the cervix itself is damaged. The same instruments can also damage the inside of the uterus, and sometimes there's a complication called uterine perforation, where an actual hole is created inadvertently in the uterine cavity that could lead to very heavy bleeding. Sometimes it could require converting the surgical case to an open case to prevent any kind of intra-abdominal bleeding. Then I also alluded to the fact that if the termination is done very aggressively with sharp instruments, there is a small risk, but it is an existing risk, that scar tissue will form within the uterine cavity, and that has the ramifications of either causing a woman not to be able to get pregnant or preventing a pregnancy from implanting fully, which could lead to a miscarriage. Sometimes there could be a growth restriction of a subsequent pregnancy where the uterus is not allowed to expand because of the scar tissue, and the fetal growth is restricted within the uterus. The baby may be born small, and sometimes scar tissue within the uterus, even if there is a pregnancy and it's not miscarried, can lead to an abnormal placentation. The placenta can implant on the area where the scar tissue formed. Then it can become very difficult for the placenta to be removed at the time of live birth, at the time of actual labor, and that can lead to other complications, including heavy postpartum bleeding. In some cases, women may suffer from infertility even when the abortion was performed many years prior to the time that she seeks help for fertility treatments. The reason is that the damage, most of the time, if it occurs from a terminated pregnancy, from an abortion, happens almost immediately. So women may not even know that they have significant scar tissue, for instance, within the uterus, until they're ready to have another child. And so, absolutely, an abortion many years ago can still lead to infertility many years past.